So our topic of today is this: should you remove your tonsils? Okay, and we're going to discuss about these things. And I have, a different perspective on this. And I'm going to come back at this. So I always want to give you my perspective first, and then I believe that I'm going to present a case to you and see if I make sense and see if the information I give you would be something that you would want to take to heart. You talk to your doctors, things like that. But remember this: I tell people, think of it like the whole nutrition thing. I'm not a carnivore. I like meats. I'm not a vegan. Okay, I'm kind of in between. Doc, and I don't like this. Surgery's always bad. Surgery's always needed. No, I'm kind of in the middle. Do you know what I'm saying? I would tell you by far, sometimes surgery is needed, and they need to be removed. And I know that's made some of the audience mad. On the flip side, I think the surgeries are way overblown, and the vast majority don't be needed. And I just made some people upset there. Like I said, welcome to my world. But the idea is this: is because I'm sitting in the middle going, yeah, sometimes I can see it, sometimes I can't. But the thing about a different perspective, the thing about the wellness way, and why actually being a chiropractor is so great, because a lot of it's prevention. A lot of it is what can we do to make sure the body's just functioning well and doing well, so we don't have to get in that situation. Because sometimes you get in a situation where you have no choice. Excuse me. Sorry about that. I haven't sneezed on a show, Aaron, in a long time. So, but anyways, here we go. So what I'm going to do is I'm going to present, and I think we need to have a greater concept of what the tonsils really are. And the reason why I have to do that, because if you understand what they are, then you understand the value of it. You hear this all the time. Well, you can live healthy without a gallbladder. Well, not really. Okay, you can live without a gallbladder, but there's things that they need to tell you and they don't tell you. There's things with the tonsils. Can you live if you have them removed? Absolutely. It's not like your heart. No one's going to die if they have their tonsils removed. Not only that happen is if all of a sudden they made a mistake during surgery and you bled it or some of that, but just if they safely go in there and remove your tonsils, you're probably going to live. You know what I'm saying? But I want you guys to understand the effects that can happen from it. And why would they even need to remove them in the first place? Or let's say they don't need to be removed, what can be done to actually reverse that process and keep those wonderful things that you do have? Well, because what I'm going to do is this, is I'm going to start with a whole different perspective when it comes to the tonsils. But let's talk a little bit more about this. In order to really understand tonsils, there's one system in the body that you have to understand, and it's the immune system. So what I'm going to do is I'm going to take an avenue from a medical website, a really respected hospital system. They do a lot of research and things like that. So I'm going to take theirs, and I'm going to use their words. I'm going to give a different perspective of it, and then I'm going to show you some of the things I believe that can be done. And I believe that I'm going to show you both sides. I'm going to show you the medical side, show you our side that way, and like I said, which is more in the middle. I'm going to show you, and I'm not the person that says the tonsils never be removed, but the idea is this: let's kind of work about it, and let's define once again a little bit about the immune system itself. So here we go. Let's take Cleveland Clinic, and once again, I can honestly tell you I agree with the vast majority of things that they post here. Here we go. Because I typed in tonsils, and actually I pulled this up, and here we are, the immune system. Your immune system is your body's first line defense against invaders like germs. Agree. It helps protect you from getting sick and promotes healing when you're unwell or injured. I agree. You can strengthen your immune system by eating nutritious foods, exercising, and getting enough sleep. 100% agreement so far. 100% agreement. I agree with every aspect about that, what they said there. And think of it this way. And believe it or not, when I typed in tonsils, it talked about the tonsils, and this is the first thing that came up. So think about it this way. It didn't say, to make your immune system better, remove your tonsils, okay? But once again, we'll get there, okay? So let's take an overview. Let's take a look. What is the immune system? The immune system is a large network of organs. Now come back to me on this, Travis. I've always said, and once again, and you guys know my background's immunology. And I can have to tell you, I have 30 to 50 textbooks. I'm just trying to give a rough estimate that way. That I've read of immunology and stuff like this, and I always tell people the immune system is very hard to define, because even in the immunology textbooks, you can go to a different textbook and they define it differently. Because why? It's a bunch of organs. And some people say, well, this is immune organ and this is immune organ, because if there's one system in the body that actually basically, affects everything, it's the immune system. And that's why it's one of the first lines of defense against anything from the outside. And the nervous system is another fantastic thing, and that's why I always tell people, if you really want to look at sick people, there's some immunological or neurological issue that's contributing to it. Even people say, Doc, but you got so well known for hormones. Hormones are secondary. I just made a post about this. Your immune system can tell your hormonal system to react. Your nervous system can tell your hormonal system to react. Your hormonal system just doesn't react. There has to be a messenger, because the hormones stand for Latin for message. But let's take a look. Here we go. Your immune system is a large network of organs, white blood cells, just think of Lewis and Mr. Pac-Man's, proteins, and chemicals, hormones actually. These parts all work together to protect you from germs and other invaders. Exactly. Your immune system also helps your body heal from infections and injuries. 100% agree so far and everything that way. Once again, when it comes to the tonsils, so far we're in agreement on there, but here we go. Functions. What does your immune system do? It helps work hard to keep you healthy. I agree. Keeps invaders like germs out of your body. Agree. Destroys invaders. Agree. Limits how much harm your invaders can do if they're inside your body. Agree. Heal damage to your body. Agree. Adapt to new challenges and threats. Agree. Invaders to your immune system protects you against bacteria, viruses, fungi, parasites, cancer cells. Absolutely. So far, once again, we're in 100% agreement on all these things so far. It's going well, okay? I'm loving this whole process. Here we go. How does your immune system work? When your immune system is working properly, tells the difference between cells that are yours and others that don't belong in your body. 100% agree. Just let you guys know this, okay? Do you understand that just like there has to be a message, we have little messenger signals from everything from proteins to little flags that pop up to the immune system reacts to that if all of a sudden a cell gets an infection. Do you understand? I always tell people, it's like I've put up a picture, I like the movie Hercules with The Rock, and he throws that lion on top of his head that he killed, okay? When the immune system eats something, or a cell actually is infected, what it does, it puts like that cloak over it. And all of a sudden the immune system comes along and eats it up because it is triggered. It is responding to that signal, but let's keep going on. It activates and mobilizes to kill germs that may harm you. Agree. Ends the attack once the threat is gone. Yep. Learn about germs after you've had contact with them, develops antibodies against them. Okay, agree, but part of the truth. Part of the truth. Because what they should say is antibodies and other cells, because you have T cells that you do respond to that stay there. So the concept of antibodies are so overblown. It's not that they're not an important part. It's just that because you are so conditioned to think about one thing, they want you to focus on antibodies, and we'll talk about that in a little bit. Here we go. Sends out antibodies to destroy germs that try to enter your body in the future. That's a partial truth, okay? But things don't always go this smoothly. Sometimes your immune system doesn't work properly. It always does. For example, it may be weak to fight off invaders. I agree with that, but that's deficiency. That doesn't mean it actually is something's wrong. Or it may launch too strong of a response. Well, that's not really true either, okay? See, for example, your body has the ability to produce cells that actually produce them, and it can produce other cells that actually can keep it under control. But if you are deficient in certain things, you can't produce those cells that say, hey, calm down. So the ones that are supposed to attack, they are produced. But therefore, it wasn't produced too much a response. There was a balance that didn't belong there. Okay, here we go. Weak immune system. Many different conditions can weaken your immune system, I agree, and make you more susceptible to infection. Agree. Conditions at birth are less common than those that develop later in life, like type 2 diabetes and cancer. Hold the phone. Hold the phone. I love when these people, these nutrition experts, get on and say that, guess what? Sugar doesn't affect your immune system. What are you talking about? Do you understand? Because if you look at, once again, high blood sugar can lead to it. Now, once again, I've taught you guys before, maintain a very good blood sugar is very essential and healthy for life. But if you get too much sugar for too long a time, you're going to affect your immune response, okay? And also cancer. Cancer is an immune deficiency syndrome because, once again, we have abnormal cells all the time. The immune system is meant there to destroy them and rid them because cancer cells put up little flags for you to destroy them. But when it doesn't, it ends up there. But let's take a look. Next. Here we go. Anatomy. What parts of your body make up the immune system? So come back to me, Travis. If you think about this, you can honestly say if you look at the defense mechanism of your immune system and how it responds when the first invaders, it keeps everything good, helps you heal, does everything. And if you look at it this way, then, wow, the immune system is very important. But let's take a look at the immune organs. So as you talk about, it's a vast array of organs. So let's take a look. Here we go. What parts of your body make up the immune system? Many parts of your body, including immune system organs and cells, which work together to keep you healthy. And the main components of your immune system are white blood cells. Okay, once again, they actually circulate antibodies, 100% agree. Okay, I'm going to come back to this, but let's just go on. Cytokines, once again, they're protein messengers. Complement system, a group of proteins. Lymph nodes, okay. Spleen. Wait, hold the phone. Aaron, can you do me a favor? Dr. Emily, Dr. Destiny, can you do me a favor? After spleen, what does it say there?
Tonsils and adenoids.
Hold the phone. Let's come back here, Travis. So the tonsils are part of the immune system. Adenoids are part of the immune system. That means all that good protection system that you have, it's an immune gland. It's there. So all those great things that help us heal, help us deal with these invaders, it's right there. Let's go on. Thymus, it's by the chest. Bone marrow, skin, okay? But I want to keep this up, Travis, for a second. I want to come back to this. Look at that up to the top right. You can see the adenoids and tonsils. Yes, the adenoids end up in the mucosa, up in the nasal cavity, and if it does swell. If you look at tonsils coming down the throat, if it does swell, can it block some airways? But if you look at it this way, it's connected to a major lymph nodes and lymphatic system through the whole body. And therefore, all these organs are put together to actually deal with the invader. So if the tonsil swells, guess what happens? You probably have immune swelling in other parts of the body. If your adenoids swell, if your thymus, if your spleen, if your lymph nodes, the bone marrow. So if you look at all these things, if there's an immune response, there's going to be a conglomeration of immune cells there, okay? So understand, that right there should give you some understanding going, well, if the tonsils swell up, that means it's trying to protect itself. Maybe protect the oral cavity. Maybe protect something that came through the nasal cavity. Now, let's take a look here. Conditions and disorders. What disorders and diseases can affect the immune system? All right, so what does that mean? That means there's conditions there that your body can come contact to that creates invaders that now can lead to swelling, inflammation, and damage to these immune organs. Allergies, oh my goodness, right there. It's a reaction to a substance that's normally harmless. Autoimmune disease, conditions where the immune system attacks these cells. Primary immune deficiency. Yeah, you're right. If the immune system actually is deficient because you're nutrition deficient, you're actually having too much sugar. You're doing all the things you're not supposed to. You're going to be immune deficient. Infectious disease. You can just come in contact with something and things are going to swell up. But how you deal with it is dealt with your immune system and how strong it is. Cancer, certain types of cancers, leukemia, lymphoma, can weaken your immune system. See, so all of these things, once again, are triggers to the immune system that now our immune system has to respond to, and where you respond to it from is going to know if that organ swells and even can repair and have damage. See, that's why consistently eating allergies, consistently breathing allergies could cause the adenoids, tonsils, and other lymph nodes to swell, which is going to lead to chronic pain. It's going to lead to the swelling of the throat. It's going to lead to those. So yes, I don't disagree that people that actually have had tonsils removed, they go, Doc, I feel so much better. And I saw in the comments, it changed my life by taking it out. Yeah, but guess what you did? You removed an immune organ that helps you fight off and defend and heal instead of finding out what triggered the tonsils, adenoids, and other immune cells to swell. See, so you lowered your defenses. I want you to think about it this way. You lowered your defenses. Now think about this. Here we go. Additional common questions. Why is my immune system so weak? Hold the phone. I cannot believe that Cleveland Clinic actually asked that question. Why? See, if you think of it this way, tonsils continually swell. Let's just pull them out. Adenoids continually swell. Let's just pull it out. But you know, why don't they take out other immune organs? Because you know why? Because there could be life-threatening detriment to it that way. But just because those, like if you take out an immune organ, that can lead to you passing away, it doesn't make the tonsils, adenoids less valuable, because they all have a specific function of protecting you from invaders and helping you heal and recover from anything. But let's take a look. Here we go. Why is my immune system so weak? Many different medical conditions, medications, and lifestyle factors can weaken your immune system. See, let me tell you some of the criticism and why people, when I emotionally stimulate you, I emotionally trigger you. Because here's what happens. My job, given different perspective, is very simple. If I saw on the sheet that their history, and all of a sudden there was a medication that caused primary immune deficiency, which cause you to lower your immune system, which could lead to other problems. I would say, listen, I'm not giving medical advice, but I would go talk to your doctor because some of the things that you're suffering with is an immune problem, and they're putting you on a medication that lowers your immune response. Now watch this. Go back to it. Lifestyle factors can weaken your immune system and prevent it from defending you as well as it should. If you feel like you're always sick and have symptoms that never go away, make an appointment with a healthcare provider. They determine if you have a weak immune system and what's causing the issue. Really? Really? Travis, go back to that. Let's look at that last sentence. They'll determine if you have a weak immune system. Where's your lab? Where's the lab? Somebody tell me the last time that you had your B cells, your T cells, your antibodies, and everything measured by your primary care doctor. And what causing the issue? Man, if that happened, I wouldn't have a company. Honestly. You say, tell me the last time if you go on our website, thewellnessway.com, and just go look at the immune panel, which is just markers that you can go to any doctor and get. When was the last time your immune system tested? And then on top of it, where are the deficiencies and where are the problems that are leading to why it's not there and what's causing these things in the first place? See, so everything on this website is kind of right. I loved it. That point right there is some things that we could have explained a little bit more, but not us, but the website. But then I'm going, they'll determine if you have a weak immune system and what's causing the issue. Let's continue. Here we go. Common tests that check the health of your immune system. Antibody tests, complete blood count, that's the most basic, complement C3 proteins. Guess what happens? That is a very incomplete view of how the immune system works. An extremely incomplete view. I could give you the most basics of any immunology textbook that I have, that from all my courses, and you're telling me that's immune testing? I'm telling you right now, I can show you immune test after immune test after immune test, showing you the major deficiencies in certain T cells, natural killer cells. All things, if you just looked up, would be a basic Google search. You go, these things are so important to see if our immune system is working. If you look at during COVID, they even studied natural killer cells, said, listen, if natural killer cells are low, you can't even really fight off COVID well. I'm so happy that Trump and Biden said, let's get them measured during COVID so you see how your immune system is doing. Now you know they did not do that. But we did. Let's continue. What medications can affect your immune system? Some medications do important work in your body, but in the process can weaken your immune system. I agree with that. I totally do. Corticosteroids, immunosuppressants, chemotherapy. If you need any of these, talk to your healthcare provider about how you can support your immune system. Okay, let me see a question. You want to talk about your healthcare provider. The average healthcare provider has a medical degree. Well, I believe it's a good degree. Got one, great. But what's their education that tells you how to support your immune system? Talk about lifestyle factors. Okay, what foods? What herbs? What nutrition? See, so which healthcare provider? Because the healthcare provider that's giving you corticosteroid has very little to no knowledge, if any, about what to give you to how you can support your immune system. I think you need a different perspective on that, but let's continue. I love this, the most basic parts of immunology that I love talking to doctors and nurses about that they basically go over briefly in school. Innate immunity is protection that you're born with. Your innate immune system is part of your body's first line of defense. It responds to invaders right away by attacking any organisms that shouldn't be in your body. It doesn't need prior training to tell the difference between cells that belong in your body and those that don't. Those are very important. You're born with them. That comes from your mother. You can develop those things. You can actually get them through breastfeeding too. If you look at, for example, it talks about your innate immune system. It says right out, it's your body's first line of defense. Antibodies are not your first line of defense. Let me say it again. Antibodies are not your first line of defense, even though it's all you ever hear about, because I'll show you why. Here we go. The white blood cells involved in innate immunity don't learn to recognize certain invaders. They also have no memory of attacking invaders and don't offer protection against specific germs in the future. That's where the acquired or adaptive immune system comes into play. Acquired immunity, also called adaptive or specific immune, is protection your body gains, acquires over time from exposure to germs. Hold the phone. Let me take a little sip here before I kind of go postal. Travis, don't put it up, but I'm going to read it, because look at my face on this one. That's where acquired immunity comes in play. Acquired immunity, also known as adaptive or specific immunity, is protection your body's gains, acquires over time from exposure. Exposure. Let me say it again. Exposure to germs. Travis, pop it up. Third paragraph, over the right, exposure to germs. So even if you wanted to get through COVID and you didn't have immune deficiency, exposure was your best way, by far. Now, I will tell you this. There's a lot of people out there that are immune deficient, didn't know it because their doctors don't tell them. Doctors don't tell them that their drugs do it. Doctors don't tell them that the stuff they tell you to do does it. So therefore, even people that didn't know they're immune deficient came in contact with COVID and died. But the idea is this, the only way that you do that is by exposure and going through the proper channels to build up a proper immune response. Here we go, let's go on. Certain white blood cells called lymphocytes remember specific invaders and can tell when they don't belong in your body. So if those invaders try to get in, again, the lymphocytes can quickly spring into action and work with other cells to eliminate the threat. Oh, here we go. Here we go. There's the magic bullet. Vaccines support your acquired immune system by training its cells to identify and destroy invaders before they make you sick. Oh my goodness. If you go on TW+, I will show you how that statement alone is very misleading. It's actually very misleading. Because do you understand that vaccines itself trigger the immune system and even lead to allergies? So they could make your immune system swell. So let's go on. How can I boost my immune system naturally? I hate that word. I hate the word naturally. It's like, how just can I take care of my body? Okay, here we go. No one likes getting sick, and it's common to wonder how to improve or strengthen your immune system. Now, once again, hold the phone, let's go back here. You don't strengthen your immune system. Your immune system has a normal range. And if you're deficient, once again, you're gonna take some things and do some things to get it to a normal response. You're not strengthening it by taking care of it. Here we go. Because your immune system is complex, there's no fast and easy answer that works for everyone on how to build it up. But there's specific things you can do with different testing than what they told you. That's why it's important to talk to your healthcare provider about what? About what? They can give you individual advice based on your medical history. Really? Because most medical histories I ever did, they give you immunosuppressant things. They'll also talk to you about your lifestyle and daily habits to see what changes you can make. Oh my goodness. Really? Because the advice they give you is really bad. Here are some general tips to keep your immune system running smoothly. Fill your plate with healthy foods, okay? Build exercise in your daily routine, great. Keep your weight, that's healthy for you, good. Get some Z's, great. Agree with that one. Stay up to date on your vaccines. Oh, you had me until we got to vaccines. Now, here's what happens. So what they've done is they didn't really even guide specific or tell you what labs and what cells were. Let me ask you a question. What foods are good for natural killer cells? Do you know? What foods are good for T cells? Do you know? What good foods are good to actually produce B cells and antibodies in that? Do you know? Is there certain herbs that can do certain things? Do you know? Your healthcare provider is not going to teach you those things because it's not their background. Okay? Now that being said, there are consequences of long-term problems to where the tonsils are so swollen they can even have stones, they can even have scar tissue, they can even be so bad that I don't disagree. I've looked at some tonsils and I'm like, oh my goodness, they need to be removed. And you say, and I said, I want you to send you to the doc, and the doctor looked at him and said, yeah, we got to pull them out. And yeah, did their breathing get better and was it easier? Yeah, absolutely. But the idea is this, just because you remove that immune organ doesn't mean the triggers are still not there. See, that's the thing. Because that tonsil, that adenoid is connected to a whole bunch of lymphatic areas that there could be some other area that's swollen and the tonsil's reacting. And so therefore, I want you to think about this. When you breathe something in, the tonsil can be a defense mechanism to protect the lungs and other areas of the body. That's why there's a significant amount of documented research about the consequences of tonsillectomies. So what I did so you guys could have this for your research, I pulled out a bunch of studies to show you that what happens post-tonsillectomy. And it's not good. It's not good at all, okay? But people say, but what they do, just like the people made the comments, and I saw probably 1,000 comments. Doc, everything changed. I felt so much better after. Well, no kidding. Here's what happens. I'm gonna do this. Erin, let's do a little experiment. I'm gonna smash Erin's finger, her thumb, every single day with a hammer. Okay? Just every day, just a little bit. Not break it, just a little bit. And it's gonna swell. And would you agree with me that it'll be hard to move your finger, Erin? Okay? Would you, keep the camera on, Erin. Would you agree with me that probably be a little pain?
Yeah.
Would you agree with me that you're gonna probably not wanna move that hand that much?
Yeah.
But what we're gonna do is just gonna cut the thumb off after some short time.
That sounds like a terrible idea.
It sounds terrible, but your doctor said let's cut it off. See, it makes no sense whatsoever. Why don't you stop actually smashing your finger with the hammer? And we all sit here and laugh and things that, but that's what happens. We accepted it as common practice, but don't accept common as normal. Let's take a look here. Acute tonsillitis. Here we go. Acute tonsillitis is an inflammatory process. Absolutely, I agree with it. Of the tonsillar tissue. And it usually infectious in nature. Acute infections of the tonsils predominantly occur in school-age children. But patients of any age can be affected. Tonsillitis of viral origin is usually treated with supportive care, because that's the only really effective virus. Bacterial tonsillitis is most common by Streptococcus pyogenes. Okay, and it talks about how this is the major bacteria that causes it. Man, I wonder if there's a different perspective of actually maybe something can actually keep this bacteria under control. Oh wait, there is. Essential oils, okay, oregano, you know what I'm saying? It's kind of cool. I can go on and show you all the research talking about oregano and sage inhibit the growth and the biofilm formation from it. Its effective concentration of oregano and sage. The phytochemicals help develop the plant-derived antimicrobial agents in the management of what? Oh my goodness, tonsillitis. So guys, if that bacteria is the primary focus, I'm not saying that all of them are, just like UTIs. Not all infections are E. coli, but when you have this repeated with A. But guess what happens? Oregano oil has an effect on the major bacteria that is used for tonsillitis. Now you could be viral, you could be other bacteria, but see, that's what we need to find out. And so therefore, let me ask you a question. Would it be worth doing something like oregano oil compared to possibly even taking out? I'm not saying this is an alternative. I'm saying that if you have repeated bacterial infections that were with Streptococcus and it actually has them end up pulling them out, I would try to do anything I possibly can as long as there was no permanent damage or massive scar tissue that you couldn't recover from. But let's continue. Wait, associations between vitamin D deficiency and recurrent tonsillitis. You're right. See, vitamin D is one of the major factors to the immune system, and they've studied this like crazy and looked down below the conclusion. The low serum levels of vitamin D was found to be associated with recurrent episodes of tonsillitis. It's important. Vitamin D, it's important. But also make sure when you take vitamin D, make sure that has K2 in there. But guess what? Guess what happens? If you have a disruption in other immune areas, like the microbiome, and there's a ton of lymph nodes and a part of the immune system that does reside within the small and large intestine, it can circulate and even cause your tonsils to swell. Hold the phone. You're telling me that if another part of my immune system actually swells, my other immune organs can swell? Yes, it can. And that's why if you notice, here we go. Recurrent upper airway inflammatory and infectious processes are polymicrobial. Chronically, as such processes appear to be related to variations in microbiome composition and interaction among various taxonomic units. Knowledge of the microbiome's composition together with traditional clinical biomarkers, which means let's make sure everything's normal, can also determine the relationship between oropharyngeal microbials and systemic pathologies to determine preventative changes in lifestyle, eating habits, exposure, environmental exposure, and use of probiotics like fermented foods. Guess what happens, guys? There's major causes of tonsillitis from sleep deficiencies, mouth breathing, which changes the microbiome, facial, oral development, things like that. And once again, I posted all the research to show you this. The nice thing is this. Do I believe that sometimes the tonsils are so chronically infected that scar tissue and damage can happen that they may need to be removed? Absolutely. I've seen it. I've personally seen it. I was even sad, and my thing was, man, I wish we could have got it earlier. That's why it's important for the microbial balance. It's really important to understand your immune organs. That's why when I started with the immune system, it's so very important to understand that the immune system helps as a major defense mechanism, and it affects many organ systems in the body. And if your tonsil is swollen, probably some of your other immune organs are swollen too. And if you have a disruption in the microbiome, you have disruption in the oral microbiome, you have disruption in other viral things, it can lead to chronic swelling of these tissues, which can lead to scar tissue and damage. So these are very important factors to look at if you have, or if you had one or multiple that way. I think this is a very important, and I didn't realize that our video would have over 100 million views just from these things. Now, as you guys know, we have our TW Plus, we have our private website, thewellnessway.com/ADP. Go to shows and you'll see ADP. What we're going to do now is we're going to shut it off from all the platforms. We're going to shut off the platforms from Facebook, Instagram, all things like that. But before we do it, as you know, you've been interacting with Dr. Destiny, Dr. Emily, and actually Aaron. So we're going to hand it over to them to do some wonderful giveaways. Just remember, what I want you guys to do is, first of all, thank you so much for joining our protein challenge. I'm excited for all of August. Yes, it's my birthday here in 2 weeks and 13 days. 2 weeks from today, we have the August 17th book launch of this wonderful book. You're gonna be able to get it in person. It'll be sent out August 17th to all the people that had their pre-orders, which we've had a ton of pre-orders that way. This will be by far our best-selling book, and my 2 other books sold a ton. And it's still every single month. That being said, guys, as I always tell you guys, stay healthy, stay free, and I'll see you guys next week. For the unedited, full-length, unapologetic content, go to our website to watch ADP shows. Hit that subscribe button and join our community for the most amazing content like this every day.